Why does infantile Tay-Sachs progress so rapidly? Imagine a tiny baby's brain, full of developing connections, suddenly facing a silent crisis. That's what happens in infantile Tay-Sachs disease. It all comes down to a missing or nearly absent enzyme called hexosaminidase. This enzyme is like a cleanup crew for a fatty substance called GM2 ganglioside that naturally builds up in nerve cells. When hexosaminidase A is not there, GM2 ganglioside starts to pile up rapidly inside neurons, especially in the brain. This buildup is toxic and causes the nerve cells to swell, malfunction, and eventually die. This process begins very early, even before a baby is born, because the genetic mutation that causes Tay-Sachs affects the production of the enzyme from the start. Normally, the enzyme helps break down GM2 ganglioside, which is important for keeping nerve cell membranes healthy and supporting brain development. Without enough enzyme, GM2 accumulates in neurons, interfering with how cells communicate and function. This interference causes symptoms like muscle weakness, loss of motor skills, seizures, and vision problems. The speed of this progression is linked to how quickly the ganglioside builds up. Since infants with Tay-Sachs are born with little to no enzyme activity, the toxic buildup begins right away. During critical periods of brain growth and development, this damage is especially severe. As a result, symptoms appear as early as 3 to 6 months of age and worsen rapidly. By the time a child is around 3 to 5 years old, the disease often leads to life-threatening complications. Understanding this rapid decline highlights why genetic testing and carrier screening are so important. Tay-Sachs is inherited in an autosomal recessive pattern, meaning both parents must carry the gene mutation for a child to be affected. Identifying carriers before pregnancy can help families make informed choices. Early diagnosis through genetic testing can also guide supportive care, even though there is no cure yet. In essence, the swift progression of infantile Tay-Sachs is caused by the early and toxic buildup of GM2 ganglioside in neurons due to the near absence of the enzyme hexosaminidase. This process damages the brain during its most critical growth phases, leading to rapid neurodegeneration. This is why genetic testing and early detection are vital tools in managing hereditary health and understanding common genetic conditions like Tay-Sachs.